Good afternoon. My name is Mo Greenberg. I'm a student physical therapist and intern at Texas Physical Therapy Specialists in Bulverde. The case that I'm going to be presenting today initially was one that I thought would be fairly straightforward and a home run. Unfortunately, it's turned out to be a pretty frustrating case that still has not resolved. And so I'm going to share it with the class today. This is the patient's pain diagram. There were three areas of concern. P1 was a low right-sided lumbar pain. P2 was a left-sided posterior rib cage or T-spine pain, and P3 was a lower left side lumbar pain. This patient was a 42-year-old female working as a Department of Defense contractor in Iraq. Specifically, she was working for the U.S. mail system, and she injured herself performing repeated lifts of 70-pound tough boxes. These are boxes that are used to ship service members' goods to and from Iraq. A couple of interesting notes in terms of her medical screening questionnaire: her past surgical history. In 1989, when the patient was in her mid-20s, she was diagnosed with cervical cancer and had to have surgery to remove that tumor. The other thing that she mentioned was that she was scheduled the week after the initial evaluation to have a biopsy done on a lump in her right breast. In terms of her current medications, she had been prescribed a muscle relaxer when she was in Iraq or Dubai. She was not taking that, though, due to feeling very groggy when she took it. And she also did have imaging done. She had an MRI that was done in Dubai to rule out any type of kidney issues. The MRI that she did have, the report at least stated that there were no thoracic spine abnormalities and minimal abnormalities in the lumbosacral spine. The report pointed to a pronounced L5S1 retrolisthesis or trace retrolisthesis, and then a generalized disc bulge. Looking more specifically at her pain complaints, P1, the lower right side lumbar pain, was her newest complaint that started approximately a week ago. This was not something that she felt that she had injured while she was in Iraq, but had sort of gotten worse after she had gotten home and had become less active. P2, the left side T-spine or rib cage pain that the patient had been experiencing, was part of the original injury. As you can see there, she described the pain as a sharp pain on the surface of the skin. It was intermittent and variable. And it was interesting too because she basically said that her pain was really caused by sensitivity to touch or pressure, as well as lifting objects or sitting in the car. When I asked a little bit further about sitting in the car, it didn't sound so much positional as it did actually the part of that rib cage touching the seat, so it went along with the sensitivity. Her P3 was the lower left side lumbar pain. This also sounded more like the original pain that she experienced doing those repetitive lifts. She had noted too that those symptoms were improving over time. She did say that when she did have a cough or sneeze, that it did seem to increase her P1 symptoms that resolved after a few minutes. And the numbness and tingling that she reported really was tied in with her P1 pain, where she would feel pain in that low side of the right lumbar spine, and she felt just a little bit of what she called numbness and tingling sort of into the right buttocks as well. The patient reporting sitting and lying down as activities that made her pain worse. She reported that sleeping or laying on the couch made her feel better, and that her pain was definitely worse at the end of the day. She also had a couple of aggravating factors that were specific: lifting, although she didn't specify what she was lifting, and then leaning over while lifting. One of the examples that she gave was bending over to feed her cat, so I'm assuming holding either a bag of food or a dish, and I should have asked her to be more specific as to how much weight she was holding when she leaned over or bent over. And then she said that just any type of repeated getting up and down while in a chair was giving her problems as well. This patient originally injured herself in May of 2010 while lifting a 70-pound tough box in Iraq. She mentioned her back left side and lower right side as her current areas of concern. She did not mention her T-spine when she filled out this paperwork initially. She was treated previously. The patient is originally from the Houston area, and she did have approximately 14 treatment sessions before moving to San Antonio. I asked her what kind of treatment she had, and she literally told me that they did e-stim on her back, put ice on her back, and she basically rode an exercise bike, and she didn't really feel like it made any type of difference for her. Her goals were basically to be pain-free. In terms of her past medical history, really just the cancer incident that she had was the only thing that was significant. She said that she had been healthy. Any physicals that she had, she was cancer-free. Of course, she was going in for the lump in her right breast. She had a follow-up appointment with a doctor in Houston where she was going to have a breast biopsy the following week. In terms of what she was experiencing currently, the only thing that she reported was a numbness and tingling. She was sort of vague about that. It sounded like that P1 lower right side back pain, if she had that for a prolonged period of time, let's say while sitting in the car on a long drive or bending over or something like that, she said that she felt almost like a numbness in her buttocks on the right side. At this point in the exam, my primary hypothesis was mechanical low back pain and mechanical thoracic spine pain due to the lifting component of the injury. My competing hypotheses were looking at lumbar stenosis and possible rib dysfunction. One of the things that I had to keep in the back of my mind was the fact that this patient had a cancer history at a young age, and she was having an issue currently with a lump in her right breast, which she was scheduled to have a breast biopsy for the following week. This patient had a photo score that was pretty close to the mean score for this type of complaint. She did have elevated fear and very severe in terms of her scoring, and it was pretty evident that she was very anxious to be at the appointment for the evaluation. Based on her photo scores, the predicted change score, as you can see, is 12 points, with the number of visits being predicted at 14. In terms of the objective exam, on observation, the patient was walking in a slightly forward flex posture, and all of her movements were pretty slow and guarded. As you can see by her range of motion testing, she had pretty limited flexion and extension, and she did report that low right-sided back pain in both flexion and extension, both at her limits and her end ranges. Her side bending did not provoke any symptoms. Her manual muscle testing, she was actually very strong in her lower quarter bilaterally. In terms of her neuro testing or neuro screening, there was a little bit of differences left side versus right side in terms of decreased sensation and decreased tendon reflexes. She had negative special tests in terms of quadrant slump and straight leg raise with palpation. Central PAs to her L1, L2. She reported her P1. She did report a little bit of that numbness and tingling into the right buttocks as well. I did continue to provide some central PAs for about a minute, and she said it actually helped to relieve those symptoms, which I thought was interesting. In terms of her left-sided posterior ribs, or that T-spine complaint, which was P2, even just running my finger over the skin, just lateral to the scapula, she was very sensitive, and she actually had a very strange sort of muscle twitching and complained of sensitivity with even just touching the skin. Based on the objective exam, looking at P1 and P3, my thoughts on P1 were still mechanical low back pain. There could have been a possible sort of underlying disc involvement that could have been aggravated with some of that lifting that she had done. Her P3, which was the low left side lumbar pain, I was not able to reproduce that on the exam at all. In terms of her P2, I felt that there was a strong relationship, at least with the mechanism of injury, definitely with P3 due to the lift. In terms of the P2 symptoms, the muscle twitching with palpation, but I wasn't able to actually reproduce any symptoms with movement. So just running my finger and palpating over that area sort of produced the strongest symptoms. Movement did not really reproduce any symptoms. So my conclusion at that time was that we were looking at what likely could be called mechanical low back pain or thoracic pain, and I tried to keep that fairly general at that point. So I was thinking in my mind at the time to start with manipulation, mobilization, and starting to work on some core stability, especially for the low back pain.